Hi, how are you?
I'm good. How are you?
Very well.
So, our first guest today, Liz Beckner
Yes.
from Personal Touch.
Yeah, I mean, she solved the problem. You know,
Right.
Everybody hates to go to the lab to get their test done. They put it off if they don't have time or it's going to be crowded or there are sick people around, and she solved the problem. She has a business that enables her to go anywhere for anyone at any time to do the blood test.
Yep.
And it's not expensive. She's also got a really fascinating personal story.
Oh, gosh.
That is,
Just listen alone for her personal story.
Yeah.
It's amazing.
it's
Really
fantastic.
gave me
So,
goosebumps. Anyway,
it was great to have her.
enjoy the episode.
But what do I know? I'm just a vagina doctor. Liz Beckner, welcome to the Vagina Doctor podcast. It's really great to have you here.
Thank you for having me, doctor.
So you're owner and founder of the Personal Touch, 14-year business of phlebotomy.
Yes.
To my mind, this is offering an ultimate luxury and convenience of providing a phlebotomy service to anyone, anywhere, and any time. It's about accurate, isn't it?
That's why it was founded.
So I think you just solved the problem of blood drawing for everybody that knows about you now. But tell our listeners a story about how it started, please.
Well, I believe that a blood draw does not need to be difficult. And in my own personal experience, the lab always seems to make it a little more difficult than it has to be. 15 years ago now, my first baby was born, and he happened to be terminally ill. And in that, he needed to take a lot of medication, including one for his seizures, which needed to have blood levels, drug levels. So I took him to the lab. And even though I'm a phlebotomist, I was going to play Mama Bear, and I took him to the lab thinking the hospital must have the best phlebotomists, they must have the best tools, that's where I'll go. And I took this small 4-month-old immunocompromised baby to the hospital lab and had to wait over 40 minutes in the waiting room with a waiting room full of sick people. Obviously, protecting him, hoping he doesn't get any germs. And then I was called back for my turn. And since I know a little bit about phlebotomy, I asked for a small 25 gauge needle, butterfly. And they said, "Oh, we don't have those here." I said, I know you do. And they told me I'd have to wait a little longer, which I did. And when they came in, I let them know that my baby had no muscle tone, so he would not be moving, which in phlebotomy terms makes it a perfect, easy patient. And the phlebotomist proceeded to miss his right arm and then miss his left arm.
Oh, God.
When I asked them to do a heel stick, she looked at me and said, "How?" And so I showed her how to do a heel stick. So when I took the baby home, I said, I am never going back to the lab. I called hospice, which we were already set up with, asked for them to deliver the supplies to my house. And the next blood draw, I drew my baby right there on the kitchen table.
Wow.
Do it yourself because you can do it better.
Yes. And I was lucky enough to have my husband home during the time of my baby's life. And my husband is a writer. And he looked at me and said, "Wow, Liz, other people need this service. Not everybody can take this baby home and do their own blood draw. I think you should start a business." Since he is a writer, he's always looking for ways for me to make money. And I didn't want to have any part of that. I was taking care of my baby. But it was true. After the baby passed, I found out, I wanted to start a new career and found out that there were other people out there that needed my services. And slowly, very slowly, the business grew and grew while people found out about me.
Fantastic. Well, congratulations. You are an obvious success. But it's not limited to just blood draws. You do all sorts of things relative to getting specimens from people and getting them to the lab and in the correct fashion with the right names on it. All those sorts of things that can go wrong.
Yes.
In that passage.
Yes. We found that there are a lot of doctors here in town, naturopaths and chiropractors, and even regular MDs or functional medicine doctors that think outside the box and do different lab tests than the local labs offer. Those would be called kits, such as Genova or Alites or Vibrant America, Boston Heart Lab. And the local labs will not draw blood for those tests because they don't make any money on it. So these people want to do a test and there's no one in town that will do it. Well, I will come to the house, I will draw the blood, and then I will process it. I can centrifuge it, I can pack it up, I can freeze it, and call FedEx and get it picked up right from my house. So basically, the motto of the business is make it easy. I want to make your blood draw easy, and I can do any blood draw there is for you.
You know, I've obviously, I have used your service at my house, and one of those occasions I did a 3-hour glucose tolerance test, and
Yes.
I mean there was a perfect example of how easy it can be made, because with that test, you're doing a blood test before you take any medication. You then take a glucose load, and every hour for 3 hours you do another blood sample or two if we're checking insulin levels as well, which we were at that time. And if I was in the lab, I'd be sitting in the lab in the waiting room, surrounded by questionably sick people, and really certainly not able to eat or drink or anything. And certainly, I couldn't work out, couldn't move around very much. But because we were doing it at home, I was making patient phone calls. I was working.
Yes.
And so it was a great example of how easy this can be.
Well, as a doctor, you certainly don't have any time to waste in the lab, certainly not 3 hours. But even us lay people that aren't doctors don't have much time in between dropping off the kids at school, getting your mom to her exercise program, and then if you work, oh my gosh, trying to get to work on time. And if they order a fasting draw, there's no way you can do that with a line of people out the door at the lab starting at 6:30 in the morning.
Right.
So people always ask, how early I can get there. Being a blood drawer, I wake up early. It's my schedule. I start at 6:30. My partner start at 6:30. And if you need it earlier, we can be there earlier.
Yeah, and I've always felt that you want to get to the lab as early as possible, but there's a line outside.
Yep.
At half an hour before it's
and
open.
you're fasting, and people are sometimes they can't. If you tell them they have to fast, they instantly are stressed out about that. Like they can't have anything to eat or drink, and then they're waiting at the lab.
And their cortisol levels go up.
Yeah,
exactly.
Right.
And I think for our listeners too, to know that really the process of this is simple. You get your lab order like you normally would from your doc. You reach out to you, and you take it from there.
Exactly.
Yes. So it's very simple.
Right. And even if the doctor doesn't hand you the lab order and says, I've sent it to the lab, if it's our local lab, Pacific Diagnostic, I have a great relationship with them. I call up with the name and date of birth, and they fax the orders right over. If your doctor does prefer Quest, then I do ask that you have a hard copy, because Quest is a national lab and a little bit harder to have a personal relationship with as far as them faxing me orders. But if you have an order, I can do the blood draw. All you have to do is wait at home. I'm on time. I'm punctual. We're fast. But I'm also always willing to listen and do whatever you need to make the blood draw go smoothly. Most of us, a blood draw is not a problem. But there are people with extreme fears of needles. And in that case, I take my time. Sometimes I had a lady have me put the tourniquet on and off 6 times before she let me do the blood draw.
Wow.
But we got through it. If you have a tendency to pass out, we put an ice pack behind your neck. We lay you down on your couch. You can have your own music. You can have your own television on. And believe it or not, it goes faster than you think, and it's almost painless. With that being said, my specialty is children. And if you've had a child and you've had to take them to the lab, they don't know what a blood draw is.
Yeah.
They are scared to death. They are crying. And being in the lab is even more of a challenge. So when they're at home, when they have mommy and daddy there, when their cartoons are on, when their breakfast is at the table waiting for them, you can coax them. You can get them to have it done, and they start to have a good relationship with blood draws. Because as I say, and I tell everybody, no one's getting out of this life without a blood draw. Nobody.
Yeah.
So get used to it. They are coming.
Yeah. I found that for efficiency in my office, particularly dealing with patients on hormone replacement therapy, they come in sort of once a year to evaluate all of that. And I insist with my staff that we have ordered lab work on that patient and we got results before that patient comes in for the appointment. Then patients are not very good at that. They're reluctant to do that. So what we've done is just say, you can call Liz and she will come to the house and draw it for you. You have no excuse for not doing your blood test, okay? Yes. And because, if they don't do the blood test, we chat. We've got no data to go on. Certainly we've got to see how they are, how they're feeling, and whether there's any issue at all, and an examination if that's indicated. But if I just have to then have them go to the lab, we get the results a few days later, we try to hook up on the phone afterwards, and it's recreating the wheel again. It's just reinventing the wheel. This is so much help to me.
Well, and it's taking more time out of your schedule. And, as a busy guy, you have time, you allot time for each client, but you don't give them you don't have time for two appointments for each patient. Yeah. So let's help me help you. Yep. The information helps them to be healthy. And they're coming to you for a reason. So why not do everything they can to heed your advice and get all the knowledge they can?
Well, you've described ways that you make patients feel more comfortable in doing this, whether it's a child or an adult. But what other tricks do you have up your sleeve for those difficult blood draws?
And there are difficult blood draws. And patients tell me, I usually get poked 5 times. Oh, they can never find my veins. I have rolling veins. Well, in my many years, 14 years running my business, but I started drawing blood in 94. So now we're up to 30 years of drawing blood. I have come across almost every type of vein there is, including those people on chemotherapy, including people over 100 years old, and including a baby hours old at a home birth. So I have seen it all. And the special tricks that I do have, number one, I always carry a butterfly needle with me, 2 sizes. And the lab is supposed to fail with a big needle before using a butterfly. If a patient needs a butterfly, you need to just start with a butterfly and give them 1 poke. So, excuse me, that's number 1. Number 2.
Could I just interrupt you for our listeners? What is a butterfly needle?
That would be a smaller gauge needle with a tube attached to it so that when you hit the vein, you see a flash of blood and you know that you're in it. Instead of, for those of you that might not have the best veins, when the needle goes in, sometimes there's what we call fishing, and that is never comfortable when the needle's moving around in your arm.
Right. Okay.
So I have the butterflies. Number 2, I carry heat packs, and they're these wonderful reusable heat packs. You press a button and it gets really hot, and you put it on the arm. And when you work out or when you're hot, your body wants to cool itself by bringing the blood vessels up to the surface of the skin, and the air can then, whisk away the heat. Well, bringing the blood vessel up to the skin makes it much easier for me to feel, much easier for me to find, and the blood draw goes easier. I also have numbing cream for those of kids that are afraid or people that have a low pain tolerance. We can put on the numbing cream, and I have the time to wait for the numbing cream to work. Yeah. The lab doesn't have that time. They simply don't. So those are a few things we do, along with the ice pack to keep people from passing out if they have that tendency.
Do you ever use those transdermal lights that you can...
The ultrasound machines?
Yeah. Mm-hmm.
I believe that those are for people that maybe aren't the best at their skill. The truth is, the best way to do a blood draw is to feel the vein. Yeah. And there have even, people 200, 300, 400-pound patients. If you use a double tourniquet, if you use the heat, you can get the vein to come up to where you feel. So yeah, people, without a lot of experience, go ahead, use that ultrasound machine, but I have not found a need for it.
Okay. This is not free.
No. It is a concierge business. So you're paying for me to have the supplies, you're paying for my gas, my transportation, you're paying for my expertise, and you're paying for the convenience of being at home and having it done on time in the comfort of your own home at your schedule. So I do have a fee that I charge, and if you need me to travel to Ventura or to Ojai, the fee goes up. There's a travel fee. If you need me to take it, excuse me, hold on. If you need me to go down to Ventura to drop off at LabCorp, there's a travel fee included there because, of course, time is money. But also, there's a lot of people in Santa Barbara in which their time is more valuable and more, they have the money to pay for their time. But there are also...
But it's still not very expensive.
No, I don't believe it is. I don't believe it is.
And there are times when, I mean, you'll come to my office and do it for me, and because it doesn't need to be particularly early in the morning that we do anything, but we want to get it done and want to be as efficient as possible. And that's great. That's 5 minutes.
Yep.
I do so much better than going to the lab and waiting for.
Yep. I do.
hours.
I've done blood draws in people's homes. I've done blood draws in people's houses. I did a blood draw with a gentleman that was on a bike ride, and he just pulled over on the street and I drew his blood. I've met people at the park bench. I often draw people in their cars. If they don't want to pay the travel fee, they'll drive up from Ventura and we meet at the bottom of Carpinteria and we do the blood draw right there. If you have your supplies and everything's sterile and you have a pillow and a place to put the arm, again, a blood draw doesn't have to be difficult.
Yeah. Do you also service the San Ynez Valley?
With the travel fee, yes. And I have a wonderful girl that works with me named Alejandra, and together we can get you on the schedule and get out there. Of course, if you want a morning fasting blood draw, a few day notice is good because mornings are our busiest time.
Of course.
Yeah, but you've always been, like, when I have called you, one of my yes people I can count on, by the way.
I like to be able to say yes.
Yeah.
And so when I come up to a problem or a challenge, I always try to solve that so that I can get to a yes.
I like that about you. I like that about some of our Santa Barbara practitioners, that I can call them and get a yes.
Very much so.
Yeah.
And I work with a lot of physicians and doctors and naturopaths in town. And I'm a pretty good listener. So I've met a lot of people and I've heard their stories. So somebody once described me as having a superpower of being able to connect people, being able to connect people with the right doctor if they're going through hormones or if they're going through diabetes or thyroid. I'm also able to connect patients and clients with other patients and clients that might be going through the same thing. I have one man with a young son that has PANS or pandas, and it's a very rare kind of viral disease for kids. And I just met a mom with another boy that's going through it. And you can feel so alone and isolated, having these children where the doctors don't even have the answer. But I was able to connect those two parents, the mom and the dad, so that they can talk about what they've done and the research they've done. So that work doesn't have to be repeated. And we can just keep a strong community here in Santa Barbara.
Some of the companies that you work with will pay you so the patient doesn't need to.
That's
right?
true, yes.
That seems to be something that patients would not know. And it's up, I think, to the physicians to say this.
Yes.
This is a way you can do this, particularly the genetic testing, the Gallery testing, that type of thing that patients just put that off. They don't really want to do it. But there is no additional charge for that because you have an agreement with the company that does that.
Yep.
And can they, I know I'm getting back to the cost issue here, but presumably they can submit a charge to their own insurance and hopefully get some sort of rebate there.
They can. However, if you've ever dealt with insurance, you know that it's not really an easy thing. So if you have the time and the forms and the willingness to fill out your reimbursement papers, you can do that.
Yeah.
But I'm just going to put a little plug out there as far as, how this society might not value those people that are really valuable. The teachers are underpaid while the bankers make a lot of money. The phlebotomists, Medicare has decided that a phlebotomy reimbursement is worth $3 for people to get the blood.
Oh my God.
They will go ahead and pay hundreds of dollars to run the test. But to get that blood, to run the test, they have so severely undervalued it. Yeah. Therefore, it's not worth it to me or my company to run insurance charges. So if you have just Medicare, I don't even think it's worth your time to try to get your $3 or $6 reimbursement. Mm-mm. Some secondary insurances will reimburse $16, $30. The best insurance people I've found have been those Christian network insurance companies, where the other clients actually pay for people's insurance issues. Right. They pay 100%. So if you're in one of those, lucky you, and you can get reimbursement for my services. Now, if you have a serious health issue, if you're going through cancer, or if you have blood draws regularly, you can save up all of your receipts from me and use it as a tax deduction at the end of the year. So that's what I advise to some of my clients that see me regularly. Yeah. Go ahead and take it off your taxes.
Yeah, that's a good idea.
That's great. I, as you know, my practice is a cash-based practice too, and I've run into the same problems with insurance, and it's so much work involved. And so I couldn't imagine you having an insurance contract with an insurance company at all.
No. Well, and Santa Barbara's special that way. We have a lot of people that can't afford to take care of themselves and do have a little extra money to pay for the services and the concierge services. And if you absolutely can't, I don't want money to be a reason that you don't have my services. If you have an autistic child that just can't get the blood drawn, or if you have a special needs baby and you're working hard to make ends meet, talk to me about it. You know, I can see what I can do as a discount, because I do have some philanthropists that are clients, and they have given the company an endowment that I can actually offer discounts and take care of those people that really need me.
Good for you. That's
fantastic.
Tremendous. So do you have any funny stories to tell about any blood draw, or I just say any specimen you have to take at some time?
Well, I'd have to think about that. But, my business really did take off during COVID time.
Yeah. Oh, I bet.
Yeah.
Because those people that couldn't go out to the lab anymore and had never thought about having a blood draw at home, all of a sudden doctors were looking for someone like me, and the business was already set up and ready to go. So during COVID time, a lot of people that wouldn't usually look for me found me. And I like to say, once you've had us in your home, there's no going back to the lab. You realize like, oh, I never have to go back to the lab again. And then you tell your brothers, and then you tell your neighbor, and then you get your mother to have me come to the house. So it's a very relationship-based business in which I probably know your neighbor. I've probably been to your mother-in-law's house. And a lot of my clients know each other. And so it's fun to be in big houses in Montecito and see how they decorate their homes, because I certainly don't live like that. And it's fun to see famous people and movie stars and singers, because they're just like the rest of us, and they need their blood drawn too, but they don't want to go to the lab, not only for the time commitment, but they don't want to be looked at and oogled and ogled, by other people. So I come to those people too. And so my job is pretty fun. I enjoy it, and I like what I do.
People really like you and like what you do also. And it's actually, they actually, it's almost possessive about you. It's like they own you, that, I have my own phlebotomist.
Yes, there is a concierge doctor in town that was having patients come to his office to get their blood drawn. And time again, the patient would say, "Oh no, I use Liz. Oh no, I use Liz." Yeah. So the doctor actually reached out to me and said, "I need to meet you, Liz." So he and I had a wonderful conversation. And lo and behold, I've already drawn over half of his clients before he had them as clients, and continuing to do more of his practice.
When I may have told you this before, but when I was a student in medical school, we had to draw blood for our patients. And actually, as an intern of a qualified physician, I'd already got my license, so to speak. And but the first thing we had to do on morning when we came in to see patients in the morning was do all the blood draws. And we had no vacuum tubes or anything that would help. We had to write the patient's name on the label. Doing that on a tube, is
challenging.
difficult. But the most embarrassing thing that I ever did with blood was actually when I was a student. It was not after I was qualified as a physician, but we used to do, for a quick result on somebody, we would, if we wanted to get a hematocrit.
Mm-hmm.
So we would do a finger stick, and then we'd use these little tiny glass tubes and aspirate the blood into that tube. And then we'd plug that tube in at the end of the tube with some sort of plasticine or something like that, and put it in the centrifuge, run it round with a bunch of other similarly treated tubes, and then look at it after it's centrifuged, and you see the percentage of, we get the hematocrit in it. Well, I'd never done this before, but I thought I could do it. So I got all the patients down. I don't know how I marked these tubes that it was the right patient. I can't remember that. But I put them in and I hit the button, and suddenly there's blood everywhere. Because I put them in upside down.
Oh, no. Oh, no.
And feeling very foolish, bloody, and got to start again. So, pushing boundaries, life experience. You've done that for yourself. You've been faced with problems and solved them. You've solved this problem of difficult lab work.
I'd like to think so.
Fun fact about you is that you have traveled a lot, got married in the Czech Republic.
Yes.
Tell us that story.
Well, I did go to Pepperdine University for my undergraduate, and I was going to be a doctor. That was the plan. I had 20 applications out year after year. But before I got in, I thought I'd move up to Santa Barbara for 6 months, 6 months before I went off to medical school. Well, the first year I wasn't successful, so I put out another 20 applications, and I was going to be in Santa Barbara for a year and 6 months until I got into medical school. Well, it was the mid 90s, and it was challenging for a white female to get into medical school at that time. And one more year, third year, I'm going to put in my applications. And I met my boyfriend, now husband, and he said to me, I'm going on a trip around the world. You want to come with me? Well, I'm going to medical school when I get back, but, I'll go. And so he proceeded to take me on a 2-month trip around the world. We went to England, Greece, Egypt, Thailand, Hong Kong, and home. And by the end of that trip, I looked at him on the plane and I just said, I don't know where you're going, but I'm going with you. And I came home to another pile of rejection letters from medical school.
Oh my God.
And so I was sure that I was going to be in Santa Barbara until this man, Ben Beckner, decided where our next trip was. And then a year and a half later, we went to, I forget our next trip, but we've been to Europe, the Czech Republic, Morocco. Then we did Florida and Venezuela and the Keys, the Florida Keys. And we just kept going and going. And every time I would go on one of these trips, my family would say, it's a trip of a lifetime. This is a trip of a lifetime. Well, not really a trip of a lifetime. And we decided to get married in the Czech Republic, and we had dated, 6-7 years. And so when I told my mom, what do you think? I might get married in the Czech Republic. She said, I don't care where you get married, just get married. So it was our way of sharing our love of travel with all of our friends and family. We actually had 22 people meet us over in the Czech Republic. We got married right in the Old Town Square in the big white church, St. Nicholas Church, behind the clock tower. If anybody has seen any picture of Prague, there is St. Nicholas Church and the clock tower. So that was fantastic. And we went a couple days early, and a guide, a wedding person, took us from political building to political building and got our papers stamped and signed and official. And the church was beautiful enough, so all I needed was a wedding dress, and walked down the aisle with my dad and had my sisters there and my husband's brothers, and rode off in a carriage, just like a fairy tale. And when you get married in an Eastern European country, your last name, you are the eggs of your husband. So your last name, they add on OVA for ova, Kornikova, Sharapova. So on my wedding certificate, I am a Becknerova.
I like that.
Yes. But coming back over here, it's Liz Beckner. And the company is Personal Touch Blood Draws. But my website and my email is Blood by Liz, because people tend to remember my name. So that's what I've marketed as. And we continued to travel about a year and a half after we got married. My husband, very fit 35-year-old athlete man, had a hemorrhagic stroke. So he started having a bleed in his brain at our house. And lucky enough for Santa Barbara, we're a few minutes away from the hospital. Got him to the hospital, had a scan done. He was actively bleeding in the hospital. So we got him up to the ICU. They gave him a hemophiliac medicine that was still a trial medicine, factor 7, and it actually worked and it stopped it. But he came out of that paralyzed on the right side of his body with aphasia, difficulty talking and remembering words, and changed our life. For a year and a half married, hoping to have children, and now my husband's handicapped. And I thought at that point, like, oh, we got to have kids right now. Maybe he won't be able to. And he said, nope, I need to travel around the world again. So, what? He said, I have to prove that I can do it. And so our first trip that I described to you was going east to west. And so this time he wanted to go west to east so that we could go over that international date line and get that day back that we had lost going the other way.
Oh my God, that's so great.
Yeah. So we went back and we saw Cambodia and India and Nepal, and we stopped in Thailand again, and then I think probably back to Amsterdam or Ireland, and then home. So we got that day back, and my husband proved to himself as we're walking the Taj Mahal that he could be a father, and that his life could go on even with his disabilities, because there are still a few. And we came home and we got pregnant, and we were so happy. And that's the first baby that ended up being terminally ill.
Oh
my God. What was a boy or girl?
It was a boy. His name was Dashel, and he lived a little dash of a life, so it seems poignant now. And he had this strange recessive disease that my husband and I are both carriers of, that we had no idea of. It was called Zellweger syndrome. And my husband and I would laugh, joke so much that we were so much alike. The middle children of 3. He was the middle of 3 boys. I was the middle of 3 girls. 3 sport athletes in high school. We had so many similarities, and lo and behold, we had the same mutation in our genetics as well.
Wow.
So it was a 25% chance of every pregnancy could have this terminal disease. And after we lost the first baby, we did not want to lose another one. So we looked around town and we found a wonderful in vitro gynecologist, Renee Allen. You might know him.
I do.
And he helped us find a company called, I think it was Genesis in Detroit, that did genetic engineering. And they reverse engineered a test for our mutations, because there were no tests to test for our specific mutations. And once I did that, I was 38 years old. But thankfully, we were able to retrieve 15 eggs. They became 7 embryos.
Wow, that's amazing.
Yes, and they looked good. So they said I had young eggs. I liked that. And of the 7 embryos, knowing genetics, they did the testing, and it was just like a Mendel square, where 2 of them had the disease, 2 of them didn't. 1 had mine, 1 had his. A couple they couldn't tell. But of the embryos that continued to grow, we implanted 2, and I was pregnant with twins. I thought, wow, I'm getting paid back. And it was really, really a happy time until we got to about 19 weeks, and they were doing the CVS, which is where they check the placenta for the genetics to see if they might have the disease in case the testing was wrong. And they came back with 2 boys. They do not have Zellweger syndrome. And they're different boys, so they weren't testing the same sample twice. But one of them had a thick neck, and anybody that's been pregnant, that could be a problem. And since the genetics came back clear, we thought maybe it would resolve. And we went further and further, and good old Dr. Sophagy. I think anybody that's an older mom has seen Dr. Sophagy. He did an ultrasound, and baby A had problems. He didn't see a stomach. He didn't see a brain. There was low fluid. He asked me if I wanted to terminate that baby with a chance of losing the healthy one. We obviously could not take that chance because all we wanted was a healthy baby. So we decided we would carry to term as long as we could and have one healthy baby. And that was the plan until the unhealthy baby's water broke at 19. No, that was 19. It broke at 25 and a half weeks.
Wow.
So into the hospital I went, really thinking that I would get some antibiotics and go to work a little bit later. And they looked at me and said, nope, you're in the hospital here until you deliver, and we think that'll be any day now. So when you're left in the hospital in the middle of the night with the idea that you're going to deliver babies at 25 and a half weeks, you start Googling. And 25 and a half week babies do not have a great outcome. There can be blindness, there can be mental retardation, low growth, and that's the last thing I wanted after going through my 8 months. And we're Christians. We prayed a lot. We had a lot of people praying for us. And my husband would bring food to me every day and make sure I ate. He read somewhere that if you ate and drank, you could hold off labor. And we celebrated every single week of a non-birthday. I stayed in the hospital 5.5 weeks.
Oh, wow.
And we delivered at 31 weeks, which for twins is almost full term. And little Judah, that was a sick baby. He ended up with hydrocephalus. So he had a small body, but a really big head, because hydrocephalus is water on the brain. And he lived for a half hour and then peacefully passed, which is exactly what I had hoped for, that it would be a peaceful passing. While little Nolan, being the smaller baby at 310, was just absolutely perfect. They took him up to the NICU. He pulled off his CPAP and never looked back.
Fantastic.
He's 13 years old. He's a straight A student. He's an athlete. He's funny and kind and just a joy and a pleasure. And
Actually, he has great genes.
I just got major goosebumps with that. Oh, God, Liz.
So it's been a journey, and I've had to go through a lot of stuff that people don't usually have to go through till later life, picking out a plot to bury your child. And it actually has made me more humble and understanding what people are going through when they have a sick one in their life, when they're caring for somebody that's sick that they know is going to die with cancer or something. And I want to be the light in their day, and I want to be the sunshine, and I want to give them one reason to smile. And I hope that I'm doing that through my business.
Such a great story.
Yeah.
It's tremendous.
You absolutely are.
So thank you. It's just that extra bit.
And now you're going to get your blood drawn.
Oh, right.
Oh, good. Are you fasting, doctor?
I am. Okay. I am fasting. And
I think there's urine too. So I always bring a little urine cup and ask the patient if they want to go pee first or have their blood drawn.
I think we'll have the blood draw first.
Okay, I'll leave the cup with you for later.
But one reason, as I said at the beginning, was to make sure that people know about you, and you're not a secret anymore.
Yay.
Okay,
And you can find me online, Blood by Liz, call or text. I do have to say that texting is best. I'm in the car, I'm drawing blood, I am busy. So the phone calls don't come back until the end of the evening. And that's also when I'm taking a soccer practice and helping with dinner. I'm lucky enough to have a husband that makes dinner, but I do clean up and get the homework done for the kids. So if you want a response from me, text me and I will get right back and we'll get you on the schedule.
Thanks. And
Thank
thanks
you
for coming
so
today.
much.
It's been
Yes.
great.
Thank you.
Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.